Offering our reverential salutations to Sadhguru Sri Madhusudan Sai, dignitaries, delegates and participants, ladies and gentlemen, Namaste and a very good morning. Welcome to Day 2 of the Global Healthcare Conference 2023 here at Sathya Grama. At the outset, we extend a hearty welcome to the dignitaries on the stage. Ms. Megha Ved, Director, Corporate Affairs, Concord Biotech. Mr. Nikhil Teja Reddy, Executive Director, MSN Labs.
Srimati Uma Chigurupati, Executive Director, Granules Limited. Mr. Ramesh Babu, Chairman, SMS Pharmaceuticals. Mr. Ravi Uday Bhaskar, Director General, Pharma Excel Council.
Dr. AVM Velumani, Founder, Thyrocare. Dr. Sunil Gavaskar, Trustee, Sri Sathya Sai Sanjeevani Group of Hospitals. Mr. Malleshwar Rao, CEO, Gland Chemicals.
Dr. C. Srinivas, Trustee and Chairman of the Global Chain of the Sri Sathya Sai Sanjeevani Hospitals. Shri B. N. Narsimurthy, Chancellor, Sri Sathya Sai University for Human Excellence. And our revered founder, Sadhguru Sri Madhusudan Sai, social and spiritual leader who's spearheading mammoth service projects in nutrition, education and healthcare across 33 countries and the guiding light behind this conference.
Health is wealth is probably one of the oldest adages, yet so relevant even in today's times. Good health is an asset, yet healthcare has unfortunately become a commodity and a costly one at that. The Sri Madhusudan Sai Institute of Medical Sciences and Research was established as a disruptor of market norms with the firm belief that quality education and quality healthcare can be availed by anyone, irrespective of social or financial barriers, absolutely free of cost whatsoever.
The hospital has been a beacon of light and hope for countless patients and families, young and old, treating, operating and curing a plethora of medical conditions, gifting them all with a new lease of life itself.
We will have a short video on the transformative impact of our hospital on so many lives. May we have the video, please?
यूं ही धड़कता
This morning, we have a unique segment called Chiranjivi Bhava, wherein patients who have successfully undergone treatment at our hospitals will receive the Gift of Life certificates celebrating the sacred blessing of health and happiness conferred on them. These treatments include correction of congenital cardiac defects, procedures in ENT, and general surgery. As we call out the names, we request them to come on stage along with their family members and receive their certificates.
First is 6-year-old Anupriya R. She is the daughter of Mr. Ramanna, who's a daily wage laborer, and Gayatri, who's a housewife. They hail from a small village in Chintamani Taluk of Chikbalapur district. Anupriya was diagnosed with a VSD defect and thereafter underwent a device closure and PDA ligation in September. In just 2 months, she has completely recovered and is today leading a healthy life now.
Next, we have 11-year-old Gayatri, also from Chintamani. For many years, she used to frequently suffer from high fever, fatigue, and weakness. Both her parents, being daily wage laborers, had to work hard every day to support family members. The parents didn't have time to get her checked, but thanks to our rural school health screening program, she was diagnosed with ventricular septal defect and soon underwent a corrective procedure at a hospital without any cost whatsoever. Today she is completely healed and is all set to resume school and aims to become a doctor.
Very rarely does a person survive undiagnosed congenital cardiac defects and live to tell the tale too. Mrs. Shashikala was fortunate that the required facilities were available to her at her hometown Chikbalapur without having to travel elsewhere seeking medical assistance, and she was diagnosed during a chance routine checkup. And if not for the hospital, it would have been impossible for her husband Srinivas, who's a mechanic, to be able to afford the same. She has undergone an ASD device closure.
"16-year-old Mahesh from Dodbalapur was diagnosed with Bisol's abscess, a rare deep neck abscess which is a complication of middle ear infection. He underwent a skull-based surgery, right radical mastoidectomy under skilled experts in the ENT department, relieving him of all pain and discomfort. He's accompanied by his father, Mr. Muniraju, and mother, Gayatri, who are both farmers.
Mrs. Archana Yadav hails from Yelahanka in Bangalore rural, and she presented with chronic pancreatitis when she was diagnosed at a hospital. She underwent an open pancreatico-jejunostomy or phrase procedure on 8th November. She and her husband, Gangesh Kumar, who is a painter, are very grateful for all the loving care they received here at our hospital.
Next is Mr. Chandrasekhar, a tea stall owner from Tumkur. He developed mucormycosis due to his immune-compromised condition. Fortunately, he underwent a bilateral functional endoscopic sinus surgery and right partial maxillectomy. After monitored care and regular follow-up, he is now completely healed and happy. He's accompanied by his wife, Mrs. Lakshmi.
To bring back smiles on these faces, happiness and hope in their lives is the reason we do what we do. And for that to happen, as Sadhguru mentioned yesterday, that collaboration and partnerships are the way forward. In fact, he advocates what we call the 3S model, the coming together of Sarkar, the government, Samaj, the society, and Sansthan, institutions like ours. When each complements the other, much more can be done, many more lives can be transformed.
This morning, we will also be recognizing remarkable individuals who have achieved outstanding success in their professional areas, while also supporting the work of institutions like ours, thereby contributing to the betterment of society at large. The first awardee is Dr. Ravi Penmatsa, who is the recipient of the award for being an innovative brand leader in injectables. And collecting the award on his behalf is Mr. Malleshwar Rao, CEO, Gland Chemicals. After obtaining his MBBS degree from Osmania University, Dr. Ravi specialized in Science of Medicine from East Carolina University School of Medicine, USA. After 7 years of hospital-based practice there, he joined Gland Pharma as its executive director in 1992. Gland Pharma has established a portfolio of products across various therapeutic segments such as anti-diabetic, anti-infectives, anti-malaria, anti-neoplastics, blood-related, cardiac, gastrointestinal and hormones through a combination of delivery systems. In recognition of his deep and extensive knowledge and experience in the pharmaceutical sector, Dr. Ravi has been honored with several institutional memberships and awards.
Dr. Arogyaswamy Velumani is the founder, chairman and managing director of Thyrocare Technologies Limited, a chain of diagnostic and preventive care laboratories headquartered in Mumbai. Today, Dr. Velumani will receive the award for exemplary achievement in affordable healthcare. He is also the founder and managing director of Nuclear Healthcare Limited, a radiology diagnostics company affiliated with Thyrocare. He attained his MSc and PhD from the University of Mumbai while working at the Bhabha Atomic Research Center, Mumbai. Being an Indian scientist and entrepreneur, he used his expertise in the field of thyroid biochemistry to build Thyrocare. Today, Thyrocare is India's first fully automated diagnostic laboratory with a focus on providing quality at affordable costs to laboratories and hospitals.
The next awardee is Mr. Ramesh Babu, founder chairman of SMS Pharmaceuticals Limited. He will receive the award for exemplary achievement for good manufacturing practices in API in the pharma sector. Mr. Ramesh is a compassionate humanitarian with a vision to bring drugs within the economic reach of millions of patients. He has provided strategic leadership with his never say die attitude to not just SMS, but the entire Hyderabad drug industry in general. He has served on boards of organizations like Chemexil and has served advisor to AP state government for pharma sector.
The next awardee is Dr. Manne Satyanarayan Reddy, widely known as Dr. MSN, a distinguished entrepreneur and scientist from Hyderabad. Receiving the award on his behalf is his son-in-law, Mr. Nikhil Teja Reddy, Executive Director, MSN Labs, and he will receive the award for exemplary achievement in API manufacturing. Born in Gurukunta village, Telangana, Dr. MSN's academic journey led him to earn a PhD in organic chemistry. His entrepreneurial journey began in 2003 when he founded the MSN Group.
The next awardee is Dr. Krishna Prasad Chigurupati, a pioneer in the pharmaceutical industry, and he gets an award for leading innovation in generic drug manufacturing. Collecting the award on his behalf is his wife, Mrs. Uma Chigurupati, who serves as Executive Director, Granules Limited. He has transformed Granules India Limited into one of the largest manufacturing companies globally. A journey he began in 1984 with the manufacturing of paracetamol, and his innovative spirit led him to commercialize the pharmaceutical formulation intermediaries. Beyond pharmaceuticals, Dr. Chigurupati is an avid marathon runner conquering marathons in all 7 continents, including Antarctica and the North Pole, alongside his wife. And this feat has been recognized by the Guinness Book of Records, exemplifying his dedication and perseverance.
The final award for this morning is Miss Megha Vaid, and she will receive the Excellence Award for Innovation in Pharma, Concord Biotech. Ms. Megha serves as Director of Corporate Affairs, Concord Biotech. Concord Limited is an Indian biotechnology company headquartered in Ahmedabad and manufactures fermentation-based API sold worldwide. We are pleased to share that Concord Biotech will shortly be partnering with our nutritional program to expand our services in the state of Gujarat.
Once again, we extend our congratulations and best wishes to all awardees. On all their behalf, we now request Ms. Megha Vaid to please share a few words with all of us.
Good morning, everyone. It's indeed an honor and pleasure to be here in front of all you dignitaries and everyone present. This is my first visit here, and I got the opportunity in the morning to visit the hospital, and I'm overwhelmed by the kind of work which is being done here, such selfless work, and as Concord, I'm so grateful that we can be a part of it to support the institute in whatever little way we can. It gives me immense pride to accept this award on behalf of Concord, and I'm very happy to say that we are signing an MOU today with Annapurna Trust for starting the nutrition drive in Gujarat. Hopefully that would be one step forward to taking India's mission to a healthier India. Thank you very much once again. Thank you.
We now invite Dr. C. Srinivas, Chairman, Health and Education Trust, to address us. A visionary in healthcare, he was instrumental in setting up the 2 Sri Sathya Sai super speciality hospitals at Puttaparthi and Bangalore, established by Bhagwan Baba. Under the divine guidance of Sadhguru Sri Madhusudan Sai, Dr. Srinivas today leads the largest chain of pediatric cardiac care hospitals in the world without a billing counter. May I now invite Dr. Srinivas to address us all.
Most revered and beloved Sadhguru, our inspiration and motivation for all the good that is being done, both by what we see with our eyes and for many of us present here, what we don't get to see with our eyes. Most distinguished ladies and gentlemen on the dais, remarkable luminaries in the field of health, particularly in the field of pharmaceuticals and related fields of healthcare, sisters and brothers from the faculties here, and students present here. All of us are on our journeys in life reaching a goal we have set for ourselves. All of us, consciously, subconsciously, in the pursuit of our goals and in the journeys that we undertake, whichever path or area of work that we are engaged in, are, I would say, significantly contributing to making a difference into so many lives, many of whom we don't get to see. Especially the field of pharma, I don't think manufacturers of pharma really get to see that sick person take the effort that you all have put in to making that pill, that medicine, that device, that consumable, or that piece of medical technology, and what it converts into, that is a privilege somehow for about 40 to 50 years one has got to see, because we interact, relate, live with the sick, the needy, the ones who come to take the benefit of your care and effort. And that has been a life's blessing. I can only say from this platform, on behalf of those millions who get the gift of health, who get the gift to contributing to society through their health and well-being and wellness, and to the nation, much credit goes to all you people and all of you sitting here. In our country today, in this wide space of health, wellness, and well-being, 70% is occupied, as we would know, by healthcare providers, by institutions of health, be it in the field of natural allopathic medicine or integrative schools of medicine. 20%, and a very crucial 20%, is contributed by pharma. 10% by medical technology companies today. It is a fact and feature of our times that more than 70% of health that is being provided is coming from the corporatized sector of healthcare, and 30% gets divided into the government and other sectors of institutions that provide health. But I think this particular event, which is organized to stir our hearts, to understand realities that we are living with. I must confess and confide in all of you, because we, with my brother Sunil, we work from Kashmir to Kanyakumari, from the South Pacific to the countries in Africa, and to almost every district of India that we are present in. More than 70% of the population that we still have in our country do not find access to quality, meaningful, good healthcare still, in spite of the remarkable strides that we have made over decades, and especially the recent few years. More importantly, I'd like to draw the attention to the distinguished audience. The significant out-of-pocket expenditure that families go through in our country today is a staggering 60% of our brothers and sisters and children. And we, for one, that work in our institutions of healthcare, which serve the most commonest defect at birth, which was requested by the government of India to us, that we should start a chain of pediatric cardiac hospitals because it was the commonest defect. The staggering health-related burden is 80%. 80% of the parents, families that come to us have sold their lands, have lost their livelihoods, have nowhere to go. So this is a collective platform and occasion for us to think of all those thousands and millions of families we don't normally get to see. Because it's institutions of care that get exposed to these families. Behind every figure, we all know, is a human life. And every life has a dignity to live and is entitled to wellness and well-being. What I'd like to leave with all of you distinguished people is what each and every one of us are engaged in is, and I mean this from the bottom of my heart, that each and every one of you, individuals to institutions, are institutions of national development. You, moment to moment, day to day, through your individual effort and your institutional effort, are contributing to national development. The moment we put this as the focus of our institutional existence and individual existence, you will see that you are filled with a sense of pride. When you think and believe you're living for a cause to serve your nation, it fills your heart with pride. When Brother Sunil represents the country, his heart is filled with pride. And I think we should be proud because we are serving the sick and needy of our country who have nowhere to go. And that is the mission of beloved Sadhguru Madhusudan Sai. I will leave you with some real-life, real-time examples. I'm not so sure how much you get to see the unserved parts of our country. I'm just coming from Teri Garewal in Uttarakhand. And I'll tell you something which will fill your heart with pride. We run a very large mother and child hospital in the mountainous regions of Uttarakhand, most blessedly on the banks of river Ganga. Who operates our centers? Let me begin by announcing to you that to me this is inspiration, this is a purpose of living really. We are marveled at the young stars that our country has, who have this great sense of purpose, who have a heart that feels for your countrymen and women, who have a mind that envisions to do something for society, who has a spirit that endeavors relentlessly, ceaselessly to doing good, and above all has a will to make that difference in others' lives. When we started our Uttarakhand Center, sisters and brothers, ladies and gentlemen, suddenly from the audience, a middle-aged lady got up and she put up her hand and said, "Sir, I am joining you today." She was Professor Pranati Das, professor and head of the department for 25 years at the Himalayan Institute of Medical Sciences in Uttarakhand, started by Swami Rama. Why would a professor, head of the department, and arguably, and if not indisputably, the finest obstetrician gynecologist of all of Uttarakhand, leave everything to come and serve the unserved in a small institution of Sathya Sai Sanjeevani? Today, this little institution does the maximum amount of work to serving these unserved women and children in the remotest hills parts of our country. You would all be proud to know that life in the hills is very different from life on the plains. When patients come to us and we ask them, "Aap माँ जी कहाँ से आए?" "वो पहाड़ है ना वहाँ पे, उस पहाड़ के पीछे से आता हूँ." Now I think my dear young lady who has the Guinness record of running marathons should know that these young women who come from us pahad se pahar travel hill miles of 25, 30 hill miles to come to these centers. Sisters and brothers, more than 100 mothers die every day in our country from maternal challenges. More than 1,000 children die every day as newborns in our country. So the enormity of the problem that confronts us, when I see people who put up their hand and say that now we will make a mark and make a difference in people's lives, I'll tell you about another young girl. She works in our Narendragarh Center, Outreach Center, which is again in the remote hills of the Teri Garhwal regions. I was astounded. She does day work in the center there and travels 40 hill kilometers to come to Rishikesh to do the night work, to cover deliveries that come in the middle of the night to the Rishikesh center. I said, what kind of a world are we living in? Can young women doctors whose husband is a CISF officer in Dehradun, and this is her daily routine by day and by night. I mean, what spirit of service and national submission to the nation is done by some of our young men and women who are moved by the inspiration of the likes of Sadhguru Madhusudan Sai or his master Bhagwan Sri Sathya Sai Baba. Every day when I speak to these doctors, nurses, I always think India is a country with multiple worlds that exist in it. Then I will come now to the state of Chhattisgarh. This is something I'm personally very fond of. I'll not speak of the large work we do in congenital heart disease. That's something that gets known. But what doesn't get known is what we do in the unseen parts of our country. We work in the Bastar regions of Chhattisgarh, which covers the areas of Kanker, Dantewada, Narayanpur, Sukma, and of course Bastar proper. When we went up to set up our first center of outreach and ANC care, and of course which will shortly be the next center of maternal and child health care, first ever in the jungles of Bastar. How did one get to do this? Of course, this was a request persistently made by the government of Chhattisgarh on us. So when we went on our first recce, which is about a year and a half back, something that will warm your hearts, sisters and brothers. I went on a Sunday afternoon with my team, and normally I do not know how many of you have gone to the jungles. I'm not talking of the forest, these are jungles. What do you see in the jungles of Bastar? There is more proliferation of CRPF camps for the protection of the tribals and the villages and the rural folk that live there. And even at 4 o'clock in the afternoon, my dear colleagues, it was pitch dark, because the density of the forest at 4 o'clock in the afternoon can make it like what it is 8 o'clock in the night here. And there was a profound ethereal spiritual experience, because at 4 p.m. in the jungles of Bastar, where we took up the Darbha Community Health Center, I think they're showing you some of the pictures of our work there. That's very kind of you, however quick you got to see all this. Anyway, at 4 o'clock, there is a stillness. There is no silence, but a stillness in the universe that you experience in the jungles there. the whole universe is still. Nothing moves. And that is what the jungles of Bastar is, where the world's oldest tribal populations live. And that is where, through the inspiration of Sadhguru, we do the largest amount of maternal and child health work. And what was the inspiration there? This will really make you proud to be an Indian. I met for the first time this brilliant young doctor, Dr. Mithilesh, who's part of our work. He was sitting there to receive us on a Sunday afternoon. And I got to ask him, Dr. Mithilesh, where did you study? Where did you get to become a doctor? He had studied medicine in Ukraine. And he had finished his medical course in Ukraine, and after 2 years, he was sitting here. That is a bit of a surprise, because why would you, after taking the trouble to go to Ukraine, finish medicine, choose to come back to India, which is a great and a proud thing to do, and choose to come back to your home state of Chhattisgarh? You could have gone into any of the corporate hospitals, any of the other hospitals. He chose to come back not even to Jagdalpur, where he underwent his medical initial part of his residency, but to this remote center in Darba. And here was he sitting, single, manning this center, making a difference in the lives of thousands of tribals. How can a young doctor be motivated, inspired, and make this his life's mission when he could have enjoyed the comforts of a city, of a corporate healthcare system which has the luxury and glamour of healthcare, but to sit in those areas? What is life like there? There is a spanking new ambulance which never got to work because there is no driver that comes to drive in the jungles of Bastar. And every day, what is the welcome you get there? You see hordes of CRPF battalions with searchlights scanning the forests of Bastar, you know for what. I won't tell you for what. And here we go into remote areas, and not only have we saved the lives of hundreds of pregnant women, not only have we made a difference to thousands of stillborns otherwise who should have died, not only have we given life to tens and hundreds of children born with heart disease through the screening programs we do in remote parts of these areas. This is what India's healthcare is about, which we are getting to do. I'll also bring you to another part. This is just to give you an idea. There was a request from the government of Maharashtra on us, and thanks to Sadhguru, we entered the Vidarbha region of Yavatmal. I'm sure all of you as geography, you've heard of Yavatmal and the Vidarbha region. I do not know for so many decades why a significant difference to the healthcare parameters of maternal health and infant health was not being done in the parts of Vidarbha. It fills our heart with so much of pride that today, that in the Almora, Yavatmal, Wardha, Savangi areas, where, again, something we should all take note of, the largest number of suicides in India from drought happens in Yavatmal. To operate in those areas where every other family, somebody would have died because of a famine, because of a drought, because of lack of water, they're providing health care. They're providing the pharma medicines that you gentlemen and ladies make, is something where you are serving the unserved, reaching the unreached, and thanks to you, doing the undone. And this is what is going to be making a difference to our country. Sathya Sai Baba said, Drishyam alpam, adrishyam brahmandam. In all our lives, what we will ever get to see with our eyes is limited. But be aware and be sure that there is so much more of a world which you don't get to see with your eyes that is infinite and needs all of us to put our hands, heads, and hearts together to make a difference. Ladies and gentlemen, sisters and brothers, this is a moment of reckoning. This is a moment of meeting of our hearts. This is not yet another conclave. This is not yet another conference. Here we have all assembled by divine will. We have assembled here to rewrite the definition of health, of healthcare delivery, whether it is healthcare institutions, pharmaceuticals, medical technologies, and I will add to that significant clinical and genetic research, again, where we are very actively engaged in, that we are all builders of a new nation. Every day, you are making the lives of so many children, women, and citizens of our country. And I think this is what should bring us all deeply together, because medical institutions cannot work without pharma, cannot work without medical technology, cannot work without the likes of ThyroCare, which do diagnosis across the country and across the rural parts of our nation. This is a moment of reckoning and coming together that we are all children of the same father and mother who has now brought us together to make a more purposeful, meaningful difference to those millions crying in need. I'll just leave you with this thought that there is so much that needs to be done, because what we see, I'm saddened to tell you, we have waiting lists for children who are dying, which run into 2027. There is no sense in making a statement like that. When you know the child will not make it for 3 months, what are you talking about giving a date in 2027? But we do 25 open hearts a day. We do 20 cath procedures a day, which makes it about 40 or 50 a day. But then that is grossly inadequate to the humongous problem we have. I told Brother Sunil's colleagues when we were playing Australia that India has more children with heart disease than the population of Australia. Many of them may not make it in their lives. There is so much to be done, and that is why Sadhguru has brought all of us together. And that is his great move to create young doctors of tomorrow, the Mithileshas, the Varshas, the Pranati Dasas, who will pick up. I'm sure all of you know that when we were all in the fetus, the first organ that was created in us in the fetus of our mother was the brain. And the brain gives us the power to imagine, to wonder, to explore. And that is what keeps you going. The second organ that he put in us in the fetus, not even when we came out into the planet Earth, is the human heart. In the first month, you were given a brain that could imagine, explore, and wonder. And I think that should be spurred, because we should be preparing our young boys and girls to go out into the world and into the country. Sometimes when people tell me that doctors somehow find it uncomfortable to go out, I am grateful to Sadhguru when he sent me to Raipur. When I went to Chhattisgarh, that was the best chapter of my life. You get to meet new people. You get to understand new societies, new communities. You understand their lives when you live with the tribals, when you live with the villages, when you live with the people of our country. What great richness. No classroom, no textbook, no university can teach you that when you go out to our people. When I live with the hill tribes in Uttarakhand, look at their innocence, look at their beauty, look at their willingness. They are children who have not crossed the border of their village in their life. They come and serve in our hospitals, and they work in our operating theaters. They put the scrub, they are the first scrub nurses who do surgeries, what you saw in the gift of life today. So this is the revolution moment that we are all gathered here for. And God bless and Godspeed all our efforts in making a more beautiful, healthy, prosperous, and India of well-being. No nation can progress unless it has the gift of health, and that will come from people like you gathered here today. Thank you very much.
Thank you, sir, for that very illuminating and inspiring talk as always. On behalf of all of us, we pray to Sadhguru to bless us all with his benedictory message.
Shri Krishna says in Bhagavad Gita, Yadyadacharati Shrestha Tattadeve Tarojanaha Sayat Pramanam Kurute Lokas Tadanuvartate. Which means, as the noble people conduct themselves in the society, the ordinary ones follow them. Whatever examples they set for the society, that becomes the standard for the others to follow. So on this very happy occasion of coming together of various stakeholders of healthcare scenario of India and the world, as we celebrate some of these great achievers who have done yeoman service by providing high quality pharmaceuticals, drugs, and other equipments at a very affordable cost to the people, so that organizations like us could serve more and more of the needy Indians. I congratulate them for this sacred blessing that has come upon them, and I hope that this will inspire many more in the audience and beyond to take to this path of service through healthcare delivery by making it more affordable, accessible to the people of the country, especially the rural and the poor. After Dr. Srinivas spoke about what we do and how much more we have got to do, which unfortunately we cannot do because of the limited capacities we have. We're working hard to expand, working hard to add more stakeholders to this mission of healthcare so that this delivery of healthcare can happen in a faster way to more people. We look forward to very constructive partnerships, which is the way forward. No one can solve the problems of the world all by oneself. We humans have been endowed with this special gift to help each other. As I call them, we are one-winged angels. We need another angel with another wing to fly. And these partnerships would help us solve the problems of the country and the world at large. And this conclave is just an excuse in a way to bring many of us together who think alike, who feel for the people of the country, and who have been working and have committed to work in this field of making healthcare more affordable and accessible to more people in the world. I'm deeply appreciative of the organizers, the volunteers. It's a completely voluntary effort over here for having invited so many of all of you from around the world and India, and so many of them who have joined us live due to various circumstances. I truly appreciate and admire their efforts, and I hope that more conclaves like this in the future will lead to more meaningful partnerships to help more and more people in the world. Subhashita says, Adhama dhanam icchanti, dhanamanam tu madhyama, uttama manam icchanti, mano hi mahatam dhanam. Very simple Sanskrit, which means the below ordinary people They only desire for wealth as the end of all their pursuits. The ordinary people seek wealth and good name, that is respect in the society by whatever they do. But the extraordinary people, they work for good name, for respect in the society, for that is their true wealth. And while healthcare is getting so corporatized, commoditized, commercialized every day, with many of them taking to this more like a business, a profiteering venture, we need more people who have the skills, who have the abilities of scaling and sustaining these initiatives, whose end goal is not merely making profits. Profits will follow if you do good work. But their main goal is to do good work, respectable work, that will give an opportunity for so many of those who are at the verge of collapse by giving them healthcare as and when needed, without discrimination, any discrimination whatsoever. So when I look at these corporates who are there on the stage, and many of you who are sitting in the audience and many watching, I am truly very appreciative of the fact that you have worked to bring quality healthcare to the people of this country. I know many of you are listed companies, many of you have other pressures to keep your whatever bottom line, top line and all that. But beyond that, you have worked to provide the highest quality products to the people of the country. I was in the US a couple of months ago, and we were visiting many hospitals and healthcare setups just to learn from them as to how do they do it, so that we can also apply those models in our country wherever possible and make it more efficient and cost-effective healthcare delivery. And I learned that the average cost of healthcare in the US is 10 times that of India. For whatever, from the pills that they give to the patients, to the hospital admissions, to the surgeries, on an average it is 10 times more than India. And I asked them, why is it so? They say most of the medicine is very expensive over here. The consumables and medical, whatever they use is very expensive. And I compared to the cost in India, the same quality drugs are available in India at 1/10 of the cost or even lower. And that is because of all of you, because you manufacture it here, you give it to us here, and that's why we are able to deliver healthcare in India at maybe a fraction of the cost of the healthcare in the US. So are you partnering in our venture to help more people in India by providing low cost, high quality healthcare? Yes, you are. You have brought pharmaceutical industry to the global standards. And India is not just pharmacy of the world for the sake of just because of the production in masses. We do the greatest size of bulk drugs, generics and things like that, but also because of the innovation research that you all have put in order to bring high quality pharmaceuticals at very low cost in India. And I look forward to learning and finding ways to make it even further affordable and accessible. And when I went through some of the sessions that were going on yesterday, the discussions, the technical sessions, and I was trying to understand what is that pharmaceutical industry is trying to do, the next thing, in order to provide high quality, low cost pharmaceuticals to the country. And I learned that so many new technologies, so much of investment, so much of research and innovation is going on, which is very heartening. And I must congratulate the entire industry for taking to this path. I know it is not an easy one. It has its cycles, and sometimes there are regulations, sometimes there are other market forces. So it's not an easy thing to do. I just met a couple of people who are from mid-sized pharma industry, and they were telling how difficult it has become for them because of the cost of whatever the key ingredients, which we import largely, and so many other things. After COVID, things have changed. The costs are eroding the margins, and they're finding it difficult to survive. Despite that, I asked them, so what would you do? They said, we are not going to give up because we know that somewhere whatever we're doing is making a difference to somebody's life. That is Uttama. Uttama means the best of the business people. They're not giving up their businesses because it's not making as much margins as what it made in earlier times. But they said, we are nevertheless continuing because there are thousands who are employed. And more than that, there are so many more who need this medicine today. And if we don't produce, the cost of medicine will go up. Pharmaceuticals will go up. That means less people can afford it. And that is a downward spiral. That is a vicious cycle. So this is what we are trying to break. And you are all the most important partners. While we have doctors, we have hospitals, we have medical professionals, but they'll be helpless if they do not get high quality pharmaceuticals at affordable cost. And that is something that I really look forward to working with all of you in making this healthcare model, which we have ventured out. Ours is a completely free of cost model. There is no cost at all to the patient. Of course, there is cost to the hospital, to other providers. But the patient walks in with just a pair of clothes, walks out with complete healthcare without paying even a pie. There are no billing counters in this hospital. We have all kinds of counters. Food counters, we have registration counters, discharge counters. But there are no billing counters whatsoever. And perhaps with pardonable pride, I can submit that we must be the largest chain of healthcare providers in the world who have no billing counters whatsoever, being private, not being a government hospital. And all this has happened because of people like you, who worked for a cause beyond just making margins or profits, who worked for a greater cause of providing for the need of the country, for the need of the people. And India lives in its villages, the Bharat that we talk about. And they are the ones who are in need of all the help. Our children who are studying in the Institute of Medical Sciences and Research here, paramedics, nursing, and many other training programs across Sanjeevani Hospital that we have instituted, we make an effort to pick up rural children so that they can be trained well, they get the opportunity that they deserve, and they can go back, as Dr. Srinivas was telling, those people, the Mithileses, the Pranati Dasas, the Varshas, they are the ones who have to come out of these institutions. And this is the inspiration for you. You are the inspiration for them. If you do what you're doing absolutely right, the next generation will be inspired. And from there, this inspiration kind of rubs on to other people, and the society gets transformed. In the coming years, we also want to venture into other difficult areas of Odisha, West Bengal, Telangana. We have just begun. And of course, Gujarat, the tribal areas of Gujarat. And I look forward to partnerships with all of you. Just now, Ms. Vaid said that in Gujarat, they are partnering with us as Concord Group. I really look forward to that partnership. Nutrition is at the, I would say, the beginning of all healthcare efforts. If nutrition is right, most of the health problems can be solved. So we have a vertical that provides morning nutrition to school-going children, young girls who are getting into teenage, and pregnant women, and also mothers, lactating mothers. We provide an entire range of nutraceutical products, absolutely free of cost. And we have a small factory right outside the ashram. It's called SciSure Nutraceuticals, which provides a whole range of nutraceutical products which are completely approved and very scientifically designed for all age groups of women. It's a cycle that I say. When the child is born, she needs to get the right kind of nutrition. So we have formula for infants, toddlers, school-going children, adolescent girls, pregnant women, lactating mothers, and again, instant formula for the babies, infant formula. So you have an entire cycle in terms of nutraceuticals that we are trying to do, because that is helping us solve a major issue of healthcare problems with mother and child segment of our healthcare delivery. I look forward to your suggestions and advice and partnership in how to make it even better. While disease happens and then we try to control it, that is one way of providing healthcare. But by not letting it happen in the first place, the preventive side of it, that is something that we are looking forward to working with all of you, whether it is diagnostics, whether it is nutrition, whether it is monitoring or timely advice through technology, whatever be the way. The idea is that our country is so big that we just can't keep opening tertiary care hospitals. Neither we have the capacity for it in terms of specialists, nor we can afford it because it's expensive. So the only way is to prevent it from happening by early diagnostics, by early detection and prevention. And I look forward to working with all of you, with all your expertise. We have a very, very committed and very dedicated team of doctors, nurses, paramedics, and all the administrators of these hospitals. And we are all around the country, from, as Srinivas mentioned, from east to west and north to south, and we are getting into more geographies for this only reason that it should become even more accessible to the poor patient. That patient should not even lose that day's wages in order to come to the hospital and go back. It should be so easy and so close to the patient. That is what we are trying to do. And I look forward to partnership. That is the only way forward. Yesterday, when we started the convention, we talked about the mantra from the Upanishad, which says, Sahana bhavatu, sahanau bunaktu, sahaviryam karvavahai, tejasvina avadhitamastu ma avidvishavahai. Let us work together. Let us enjoy this work together. Let us enjoy the outcomes of this work together. And let us work hard, strive, and give our best to work together. And that is how we will be able to create a better country, a better world for all of us. Not only in India, we are working around the world. We work in Fiji Islands, in the South Pacific, with the very first pediatric heart hospital for the whole of the South Pacific island nations, which never existed. So also we work in as far as North America, in the Delta region, in the Mississippi region, where a lot of African American communities have fallen through the cracks of the healthcare system in the US. And also in between in Africa, even in Sri Lanka. So we are everywhere, but what we need is to make all these very effective and sustainable. We need very right kind of partnerships. So as I mentioned, we can think of ourselves as those who just do their duty because they've got to do their duty and pay their dues to the government, whatever is mandatory and legal. Or we can also be people who can go beyond the call of duty to do more than our might in order to deliver good quality healthcare to more and more people. And we have to choose to be in whichever brackets we want to be, because both are okay, both are fine. But then the difference in the world is made by those who have gone beyond the call of duty. They have brought transformation to the world. They have left behind a trail for others to follow. And that is the kind of trail that we must leave behind. And with all of you industry experts, many from the industry, many from the government, governance, policy makers, educational institutions, All India Institute of Medical Sciences is partnering with us for this particular conference. We have some of their staff and faculty over here. We have representation from the DNB, Dr. Bajpai, who is also present over here. Also, we have representation from many other private associations of pharmaceutical industry. I look forward to working with all of you, and I'm truly grateful for you all being here on this morning to share this journey with all of us. And I'm sure we'll be co-travelers in this long, long journey, which has many miles to cover. We have just begun. But 25 years from now, when we dream of a developed nation, we dream of a nation where nobody is sick. But even if they are sick, they have access to healthcare. And that is why nobody remains sick, even if they fall sick. That is the kind of India of equitable healthcare opportunities, whether they are students who want to learn, or whether they are patients who want to access care, or whether they are industry partners like you who are trying to create the best quality products at low cost. Everybody should thrive in a country, in a developed country. That is the kind of dream we have, and we are all going to be the people who are going to make this dream materialize. That is my hope and prayer. Once again, thanking all the organizers and all of you for coming here and honoring us by accepting this little token of our appreciation for the efforts that you have put in to do what you have done for the country and the world. And I look forward to many more such conclaves and conferences and the lifelong partnership with all of you and our institutions. Thank you very much. Loka samasta sukhino bhavantu.
Offering our gratitude to Sadhguru, we will conclude this session. May I request all the dignitaries to kindly come forward for a group photograph, please. Thank you all once again. We will have a short break for 10 minutes and will reconvene at 11:30 for this morning's first technical session. Thank you.